Welcome everyone. Adnan here. Um, Excited for another episode of Digital Health on Air. For those of you who tune in regularly, I'm going to apologize in advance for my voice. It's not quite as robust and energetic as it normally is. I've been recovering here from the dreaded flu of 2025, but super excited to be joined by Tom Luby today. Tom and I have known each other since back in 2029, back in 2019, when he first started at the TMC, the Texas Medical Center. And we were at the Texas Medical Center as a early stage company at the incubator. So we go way back, but super excited to welcome him in his role today, which is as the Chief Innovation Officer at the Texas Medical Center. And of course, we know everything in Texas is big. Healthcare in Texas is big. Innovation in Texas is big. And so Tom will fill us in, but the TMC is really unique. And you know, being in the space for well over 10 years now, I don't think there's anything else like it in terms of innovation focus, depth of reach and experience and expertise into the healthcare industry and healthcare industry writ large, right? Not just little pockets of it, but healthcare as you can define it most broadly. So super fortunate to have Tom with us. And Tom, I'll turn it over to you to help us understand the Texas Medical Center and your role and what you oversee.
Yeah, thanks, Adnan. Great to be here today. And thanks for an opportunity to talk a little bit about TMC, Texas Medical Center, as it's known. It started in the 40s. It actually was a master planned medical center with the bold vision to be the biggest medical center in the world. And, fast forward 75 plus years to today, and that's true. The way that it was originally envisioned, it was a man named Ernst Bertner. He was an OBGYN here in Houston, had this idea about creating a medical cluster that could serve patients from around the world, and worked with the folks who ran the Monroe Dunaway Anderson Foundation, the MD Anderson Foundation. They provided the initial capital. They petitioned the city of Houston to sell a piece of the land adjacent to at the time, Herman Park, and purchased the land and created this master plan. And, Baylor College of Medicine came first, MD Anderson, the Cancer Center, Houston Methodist, all of these, wonderful clinical institutions arrived on campus. They did that by structuring it so the land that they purchased, they would give away to the institutions through a 99-year ground lease for $1 a year. So pre-land. Fast forward today, there's an incredible cluster of enterprise system hospitals. So it's a great place to come if you're not doing well to get better as a patient. Quite a number of medical school, nursing school, pharmacy schools. Again, wonderful place to come if you want to be trained as a healthcare professional, and then a significant amount of basic science research and research institutions. So a great place to come if you want to do great foundational science as well. So, when you walk around, it looks like a small city just south of the downtown here in Houston. And it's a great opportunity to be part of this community and do the things that we do today.
And tell us about your role, like Chief Innovation Officer, big role. Like, what's top of mind for you? What are the priorities for this year?
Yeah, so when the medical center was created, in order to oversee this master plan, they created a not-for-profit company called Texas Medical Center Inc. That's the company that I work with. And for the bulk of the time through the development of the medical center, TMC Inc. was essentially a logistical support operations company doing the things that the hospitals and research institutes didn't want to do, the roads, the landscaping, the parking, all those types of things. But because of that history and the relationships that were generated when the current CEO, Bill McKeon, arrived 11 years ago, he saw the opportunity that, we could do more. We could think about ways to create collaboration amongst the different institutions here. I mean, they compete for patients, they compete for, healthcare professional talent, they compete for grant money. But at the same time, there is a spirit of cooperation here at the campus. And one of the areas they all thought the medical center could do a better job in is commercialization. And so Texas Medical Center Innovation was born out of those conversations. We're actually celebrating our 10-year anniversary this year. And, Our group is asked to work across the different institutions here and think about ways we can support entrepreneurs, both people trying to spin companies out using intellectual property that's generated at one of the institutions here at the medical center, or like Luma, work with established companies and provide access to the platform that is the TMC to give companies and entrepreneurs a chance to be successful working here and eventually selling products here as well. So our group, has a bunch of resources that have been allocated to us, both structural programming, services in the form of consultants that we hire and make available, funding. We have a $50 million venture fund that we use for seed and Series A, and then space, a number of different types of space, specialty space that biotech or medtech companies need, but really just trying to create the package that an entrepreneur would need to be successful here.
Fasting. Well, happy 10 years. Fun fact, Luma also just celebrated its 10-year anniversary in February.
Congratulations.
So I guess we're twins of some sorts. All right. So Q1 healthcare conference circuit. I know I've been on the road. You've been on the road. We last hung out at JP Morgan in San Francisco a couple months ago. And, I think the past few years, the theme was probably more around like survive and thrive. Whereas this year it was a lot more squarely on like the potential for innovation. And so, look, at the TMC, you're always thinking about the next healthcare innovation. You have an entire ecosystem you've created to foster, support, commercialize, incubate, every version of healthcare innovation. Like, where do you expect to see the most change in healthcare this year? And you can take a longer lens, but let's start with this year and then a little bit beyond.
Well, it's always fun to be at JP Morgan. People want to be optimistic there. And I felt like people were trying to be optimistic at the meeting. It's still tough times out there, especially if we look at, like publicly traded biotech stocks, still, not pretty, how the market is treating them right now. Still early struggle to get early funding into, med tech startups as well. You got to be really scrappy in that space. And then, any of the kind of data science-based plays, SaaS models, probably doing a little bit better, but, really have to sort of take into account how much kind of AI hype is out there right now and manage that kind of expectation versus reality that's part of the fabric of that space right now. In 2025, as we are talking to the different institutions and the startups that we work with, it depends on the sector. We get excited about certain things. When we think about what we just, likely call, like probably too generally called digital, but on the digital side, of the business, there's a lot of interest in trying to figure out how to band together data here at the medical center. We have all these enterprise platforms. How do we think about creating the opportunity for collaborative around data science plays? So we participated and helped to host the first TMC, AI summit, if you will. And it was really mostly just like a call to all the data scientists in the different institutions here to come together and share the work that they're doing. Like, hey, come on, get out of your office and into the sun and talk a little bit about what you're doing and make a connection with somebody who might be interesting to you that's on campus and you didn't know about. And it was incredibly successful. Lots of presentations, lots of posters. We're curious about where that'll go. It was very sort of researchy, if you will, not surprising because of the place where things are. But I do think there's an opportunity over time to think about data sets. We look at what Mayo Clinic's done with their platform there. That's an interesting model for us to think about, or there's ways we could do similar stuff. And so that'll be a focus for us in 2025, and happy to go into a deeper dive. We still continue to spend a lot of time at early stage, really risk on medtech and biotech, both starting companies, working with entrepreneurs, matching off with IP and getting them started. And then also, bringing people from the different parts of the country. Here in Texas, we've had the Cancer Prevention and Research Institute of Texas for 13 years now, and $6 billion worth of funding. So we have access to some of that. And so we work with early stage biotech companies in oncology very effectively from around the country, actually from around the world. So that's important to us. The Texas legislature is looking at a similar fund for dementia, aptly named DPRIT, Dementia Prevention and Research Institute of Texas. That, if that passes, that'll be $3 billion worth of money again, focused in early stage dementia research, prevention, and product development. So companies that are in the space, we could be helpful with that as well. And then, on the med tech side, long history of incredible cardiovascular, orthopedics, minimally invasive techniques, just surrounded and blessed by many, many physician entrepreneurs that we are able to tap into their ideas and thoughts and start great med device companies as well.
Well, you guys play, I think, in one of the most exciting parts of innovation, which is early stage, where lots of risk, but also the coolest stuff. As you think of the companies you've partnered with, mentored, spent time with, and then you think of your member institutions like the TMC health systems, for those who are further along, like which pieces of information, which types of innovation do you see really translating into the health systems here over the next 12 months?
Yeah, I think that, you're really talking about kind of more on the digital side in that time frame. The med tech and the biotech stuff, those are all regulated process, products.
Yeah.
We'll go through, what a well-established product development paradigms and then eventually brought to market, probably in most cases, not by the startups themselves, although that's not 100% true. So on the digital side, I think the hospitals are very interested in efficiencies. So thinking about kind of some of the back office type of things that could be, made more efficient using different kinds of platforms. Lots of, focus right now in thinking about how reimbursement is affected by things like your star rating or, how CMS or IRS would treat you in not-for-profit status based on the community impact that you might have. And there are some companies that we're working with that are in that space that can automate that kind of stuff. There's, I don't know how big the consulting industry is that has sprung up around that to help enterprise systems with mostly collecting the data and filing the paperwork. But, their margin is these companies' opportunity as they think about that. So we see a lot of that. There's obviously, especially on the generative AI, a lot of, I think, I won't call it rogue, but using kind of some of the generative AI platforms out there, clinicians are using them. So I think the hospitals are trying to get a handle on, like, especially from a, patient data perspective, what that looks like. And, always concerns about those platforms hallucinating, especially in thinking about clinical care. So, there's probably a little bit more urgency with an understanding that those tools are really effective and can save a significant amount of time. But how do you want your healthcare providers interacting with them kind of outside the hospital networks, if you want that at all? And so, there's some of that that we're seeing as well.
Yeah. Okay, good. That's great. Let's spend some more time there because, look, AI is the topic of our time, and there's buzziness to it. There's promise to it. There's real ROI to some applications of it. I'm sure the TMC health systems are bombarded by, right, like 101 different companies talking about AI in some use case. I think if we were some of us were at Vive a couple of weeks ago, and there was literally 100 agentic AI companies, right, more or less saying the same thing. Like, what are the health systems asking of you guys? Like, how are they sifting through the noise, and what are they asking from you in the innovation seat to help them?
Yeah, there's always a conversation in bigger companies about, build versus buy. And, I think that when it comes to these types of models, imagining that you can build that's probably not a feasible thing. So, it is about, well, what's out there, and, how do we imagine what's the best sort of, particular solution for us. So, a lot of what we do is we spend a lot of time across a lot of companies and trying to understand how they're thinking. And honestly, I agree with you. There's a lot of companies with what sounds like, I think I just heard about this company, when you're talking to a new company. So I'm not sure the answer, Adnan, about how, somebody on, the enterprise side, kind of thinking about how do you figure out which solution you want to work with. There are networks, kind of at I'll just kind of blanket it, chief innovation officer, or people on the IT side of the hospitals where they talk to each other. And so, being able to kind of get in and have a conversation and get a pilot done, you can kind of spread to another system through kind of word of mouth. This is good, this isn't good. And so we're focused on trying to get people to get some pilots, just to get some experience in that particular system, and then maybe get good referrals off of that. Selling it right now, it feels early, just going to, the hospital and thinking you're going to walk in and sell it. I'm not sure, but walk in and pilot it, and, start to, this is the story of Luma. We're going to try and be helpful with companies to do that. And, it's probably a few different areas you could think about. I think anything that's not patient facing, and can show kind of relatively good ROI, you'll get a meeting for sure.
100%.
Anything that's kind of patient facing, it feels more cautious still.
Totally agree. Okay, I'm going to switch gears. Forward looking. So the TMC has been, one, successful, and two, now has made a lot of investments in physical campus, innovation hubs, program expansion, geography expansion, and partnerships outside the U.S. Like, I don't know if there's like a 5-year view or a 10-year view. Like, what are, how are you thinking about 5 or 10 years from now, and what are the priorities?
Yeah. I use a strategy hack with our team all the time. I call it the goldfish strategy. Actually, we'll show a picture of, goldfish trackers, large.
Yeah.
A small one, a big one.
My kids love
a bigger one. They are pretty good.
They're pretty good.
So the strategy hack is like, look, what we're here to do is, in the pond that is the medical center, start a lot of minnows or recruit a lot of minnows, and then provide them with the things that they need to grow. Many won't, but some will, to get bigger and bigger. And then, as those companies get bigger, they start to attract more talent, and we care a lot about attracting talent, especially people on the commercialization side of healthcare. They attract funding, so we get new opportunities to talk to funding partners. They take up space. We have a bunch of real estate here, so that's an important part of the things that we do. And then, then they get bigger, and eventually, hopefully, they exit, and the teams that now have that sense of experience, that experience, cycle back and do it again. So that's been our strategy really since we started for 10 years. And, we could see we're reaping the benefit of that now. As you walk around, it looks a lot different than it did 5 years ago. And so we're going to stay focused on that. We're long-term, we're patient. We'll keep feeding minnows, and reaping the benefit of them as they get stronger and larger in that sort of goldfish strategy hack. So there's that piece, and then TMC, thinking about being more. It's always been a wonderful place for translational research. There is as many clinical trials done here on an annual basis as they're done anywhere. And so, how do we think about larger industry interactions as well? Part of that is the goldfish strategy. As companies get bigger and, people think about, there's a lot of commercialization and successful commercialization happening in the medical center, that'll naturally draw strategic interest. But, when people think about they're outside of the US and they're going to come to the US, generally they think about the coasts, especially if you're a European company or a strategic, you're going to think East Coast. If you're an Asian, you're going to think West Coast. But this is a unique platform, just in terms of the density and the efficiency of engaging here as well. So we're trying to get the word out that, we've made some structural changes in the way that the medical center is set up. Just as an aside, when you originally set up, any of that land that I talked about, like $1 a year, only for not-for-profits. Couldn't be for profit and be on the medical center. That's been changed in a couple of sites. And so we're trying to create the opportunity to talk more strategically and larger with companies around the world and that are in healthcare and are interested in accessing this platform as well. So that's part of how we see it. So, if we fast forward 5 years from now, there's a number of successful companies that have started and grown. Some of those entrepreneurs are back and started their own companies. There's a stronger strategic presence here at the campus. And, when people think about, hey, where do I want to go to be successful as a healthcare entrepreneur, the medical center is one of the places that's in that conversation. That's dope.
Awesome. All right. And Kara's giving me the, hey, you got to wrap up. A lot of our audience are CIOs, chief innovation officers, chief transformation officers. Like that's kind of the core digital health on air audience. You mentioned how some of the subsets of people within the Texas Medical Center community are getting together to like figure out AI. Like any just practical, tangible advice for CIOs and innovation officers as they navigate just a lot of noise and also some transformational technology?
Yeah, man, I wish I had, like a simple, practical piece of advice. If it's like unlocked and you're like, we kind of look at it as like, if you can get talented people in the room together and begin to build some trust amongst them, we think great things can happen from that. And so we're very focused on that. One of the things is like we have all this AI or data science talent. Like, what are the problems you want to focus that talent on? And can you find one where everybody can kind of get behind and work together? We saw that in COVID. When COVID hit, we were able to pull together, at all the institutions and have data sharing. And, it was really, really impressive what happened here. And so, we're on the eye for that use case. We're looking for the opportunity to nucleate around that, all the talent that we have. People have ideas. They want to sort of see what others in the community, in a larger data science community, would think about it. We'd love to have a conversation and put it out there. It's early pulling this community together, but it's a powerful community. We do that well, so we know we're going to be successful, and so we think it's going to be a great platform in the long run.
No, I think that's spot on. Just to create the space in the forum, and then start with the problems, not looking for ways to just apply technology. Love it.
Yeah, it's always about the problems. Like, what problem are you trying to solve? It's
awesome. Tom, thank you. This has been fantastic. As always, you are the perfect balance of like super strategic, and then the realness comes with it hand in hand, which is unique. And we thank you for that. So thank you for sharing your time and thoughts with us. That's a wrap, guys. Another episode of Digital Health on Air.
Thanks, Evan. Bye-bye.